So, really important question that I think is important to answer is when on earth should I start to seek a therapist? When's a good time? Is it too soon? Am I being a little dramatic? Am I taking too much of a jump into something that could have a negative impact on myself, my child, etc.? So many questions people have about this specific idea of like, okay, when is a good time? And the way I talk about this is there's usually two reasons why people come. The first is what I call a crisis intervention. There is some major issue, some major crisis going on. I found my child is cutting. My husband or my spouse is threatening divorce. I lost a loved one. I experienced a sexual assault. So some sort of crisis situation, something a little bit more of a situational issue that's triggering some really, really strong emotions, really strong mental, emotional, behavioral response. Where my anxiety is heightened, my depression, it's my ability to function in different areas of my life is continuing to kind of down spiral. So that's what I call a crisis intervention. So oftentimes people are seeking mental health counseling because of a crisis. My life is really stressful right now. There's a lot going on and we really need help immediately. And that's perfectly good and fine, and that's important. I think everybody should seek therapy as kind of a first level of care when there is a crisis. Now, of course, sometimes therapy is not the good place for that, right? So if somebody's experiencing suicidal ideation and they're having active thoughts and they're starting to develop a plan or they've already attempted, that's somebody who should be in a higher level of care, inpatient hospital setting where they can be kind of watched and evaluated and maybe checked to see if medications would be indicated. So again, it's going to depend, but I would say sometimes that therapy is kind of a first level of care. And then so there's crisis. And then the second option or second reason why people come to therapy is for prevention purposes. And this is really, really, in my kind of clinical opinion, the best option. And the option that people fear the most. For some reason, there is, and I mean, we know the reasons, right? Stigma, taboo, fear of the unknown, don't really know what therapy is for, kind of have this perception that therapy is really for people who are acutely ill with mental illness or people who are just not functioning at all. And that is absolutely incorrect. Therapy is really great for people who are looking to prevent the spiraling of behavior of emotion. So if you're struggling with a little bit of stress at work, or you feel like it's starting to seep in, or you're experiencing some signs of burnout, you're starting to recognize some behavioral kind of like generational trauma, or so lots of different reasons why somebody might seek it preventatively, or you're starting to see signs in your child that they might be struggling with a little bit of depression, but you're not 100% sure. That is great. It's honestly the best time to seek therapy, because the more you work on prevention in any respect, it doesn't matter what it is, the more you look at something and say, okay, I want to prevent this from escalating and getting worse for myself, my child, for my relationship, etc., the more likely you are to be able to address it and kind of stop the train before the train goes down the track. So prevention is always a really, really great option. My thinking, my clinical thinking is that most people don't seek therapy preventatively because they worry, like I said, about, the stigma around it, and they don't really know what to expect. Like, I don't know what I'm going to, and that creates a lot of anxiety. There's like this anxiety about this first session. What do I expect? Or what should I expect? So I'm going to talk about that in the next video, and just kind of talk about what to expect in a first therapy session, because that's a great question. And if we can reduce your anxiety about that, at least you might be able to get your foot in the door. And for all those parents out there that worry about getting their teens into therapy early, to kind of, the fear that if we do that, their mental illness is going to get worse. No. I always say, if you're a parent, and you love your child and you see these behaviors that you're concerned about, preventatively getting them into therapy, of course, it has to be the right fit. It's got to be a good therapist. There's got to be a good jive. And that therapist has good experience with teenagers in general, or with children, depending on the age of your child. That is really a really great option, because now you're helping that child build tools, and the quicker you intervene with those signs and symptoms, the less likely they are to escalate. And you're giving them tools to cope in a healthy manner before they start using drugs or cutting as a form of coping, or looking to relationships for a form of coping. Many reasons why teens go in a direction that is not helpful or healthy. So start early. Don't be afraid of the process, and you're actually doing them a great service. And my clinical experience, I've never seen somebody put their child or their teen in therapy, and the child and teen basically just started to kind of exacerbate their symptoms or make things worse. Usually they are learning the tools to make things better for themselves and for the family, and even the family being educated on mental health, within that age level or developmental stage is super enlightening and helpful. So don't be afraid of it. Again, prevention, crisis intervention, it's all good. Doesn't matter how you get there. But I always encourage people to start preventatively. So if you see signs and symptoms, start early. And the chances of things escalating and getting far worse is not as likely because you're thinking preventatively. So hopefully that's helpful. And next we're going to talk about what to expect in a first session. Have a wonderful day.